Welcome to Journey to 600. Today we're going to be talking about peripheral nerves, specifically the lower extremity. Today we will look at the femoral nerve, obturator nerve, tibial nerve, common fibular nerve, and the sural nerve. Starting off, femoral nerve. So it gives innervation to all the quads, the rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, as well as the sartorius, pectineus, and iliacus. So I like to think femoral nerve gives rise to the hip flexors. That's very general, but that can kind of give you a good generalization. Sensation is to the anterior lateral thigh and medial lower leg. So the femoral nerve becomes the saphenous nerve, which truly gives that sensation to the medial lower leg. That's why I have them kind of split in this picture that I drew out. But it is all the femoral nerve, basically, too. So nerve testing for the femoral nerve is going to be through a prone knee bend test. And a positive test would be unilateral pain in the lumbar area, buttock, posterior or anterior thigh. Next, the obturator nerve. It gives innervation to the obturator externus and adductors. And sensation is to the medial thigh, so think like where are the adductors, that medial thigh, so that kind of goes hand in hand as well. For tibial nerve, it gives innervation to the posterior legs, so the hamstrings, the gastroc, soleus complex, and all those little posterior muscles like plantaris, popliteus, and some of those down in the lower leg are the flexor digitorum longus, flexor hallucis longus, tibialis posterior. So the tibial nerve gives rise to the medial and lateral plantar nerve that gives sensation to the bottom of the foot. As you can see in this picture, the green and the pink. So sensation is just the plantar surface of the foot. Tibial nerve will be tested through straight leg raise with hip flexion, knee extension. The ankle will be dorsiflexed and everted. The ankle components of this test is to target that tibialis posterior elongation, so this will help you remember the nerve test if you know the action of the tibialis posterior. So the tibialis posterior plantar flexes and inverts, so the tibial nerve testing will be dorsiflexion and eversion. Next is the common fibular nerve. So the common fibular nerve, or also known as the common peroneal nerve, it splits into the superficial fibular nerve and the deep fibular nerve. The superficial fibular nerve is more posterior since the common fibular nerve is coming from the posterior side. The deep fibular nerve is more anterior, that's why it gives motor to the tibialis anterior and those extensor muscles. Nerve test will be general just for the common fibular nerve, so it is a straight leg raise, but you're going to have hip flexion and internal rotation as well as knee extension, but here, paying attention to the ankle, it will have plantar flexion and inversion to stress that common fibular nerve. Lastly is the sural nerve, and it gives sensory to the posterior lateral lower leg and the lateral dorsum of the foot. But what's special about the sural nerve, it is sensory only. For neurotest, you're going to do a straight leg raise, hip flexion, knee extension, pay attention to the ankle, it will be dorsiflexed and inverted. Okay, practice question time. A patient reports numbness in their left foot. In order to confirm or rule out tibial nerve, you'll perform what test? A. Straight leg raise with dorsiflexion, eversion, and toes extended. B. Straight leg raise with plantar flexion and inversion. C. Prone knee bend test. D. Squeeze test. I'll give you a moment to look over this question. If you're not ready to go over answer, just pause this here. But going through the answers, so numbness in their left foot, and we're trying to rule out tibial nerve. So we're going to talk through these tests starting with D. So the squeeze test is a special test for a high ankle sprain, and not to be confused with the Morton squeeze test, which is a different special test. A Morton squeeze test will be indicated if you had numbness in the bottom of the foot, but it would just be due to neuromas. So right here we're just talking about trying to rule out a tibial nerve, and also the Morton squeeze test is not the same as squeeze test, so this answer is not right. Prone knee bend test assesses the femoral nerve. Straight leg raise with plantar flexion and inversion bias is for the common fibular nerve. That leaves us with A, so A is correct. Straight leg raise with dorsiflexion and eversion bias, as it makes the tibial nerve most taut in that position. Here is a little summary. As a test, you can see if you can fill this information out for memory, but if you need to, go back and listen to check your answers on the motor, sensory, and neuro test components of the femoral, obturator, tibial, superficial fibular, and deep fibular, and the sural nerve as well. So all those nerves are covered today. See if you can answer that, but feel free to purchase a copy of this editable Word document from Etsy. It will have this chart as well as some lower extremity dermatomes and myotomes that we didn't have a chance to talk about today. Thank you so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.